If someone is interested in having an appointment with us, then the first thing that we would normally do is book them in for some tests. So we've got the results of those for when they come for their appointment, so that it's a more useful appointment for them. So it depends on who's booking the appointment. So if it's a single woman, then she would be booked in for a blood test. We'd measure her AMH because that gives us a good idea of her ovarian reserve, and also an ultrasound scan. So we look at the anatomy in a bit more detail, look for any lumps or bumps that might cause problems, and also we count the follicles on the ovaries because that gives us a good idea of what their ovarian reserve is. And if you've got a female partner, then they would have a similar sort of set of investigations. If they've got a male partner, then they would be invited to have a semen analysis. And then usually, like within a week of having those investigations, they'd be booked in to have a consultation with one of our doctors. And the doctors will go through everything with them in that consultation. So they'll review their history, any medical issues that they've got, and then talk through the results of the investigations. And sometimes that might be all that people want, but if they want to then move on and talk about different treatment options, then they'll do that for them there and then.